Now with a report on childhood obesity, here's our reporter, Laura Windsor.
If your child is 20, 30 or more pounds over the normal weight for their age and height, they may be at risk for numerous diseases. Dr. Rodolfo Perez of St. Jude Medical Center in Fullerton discusses the problems of childhood obesity.
Child obesity is defined by a couple different things. One is a kid who's 10 to 20 pounds overweight. Another is the new insurance term, the BMI, the body mass index. You know, when it's greater than 20-25, is that an obese child? I think you can measure it statistically and with numbers, but I think it's more intuitive than that. I think you can look at a kid and say, the kid's overweight. Like that's a problem there. Obesity leads to a lot of different gastrointestinal cancers, esophagus, large intestine, higher breast cancer when you're obese. Diabetes, which obesity leads to, can then subsequently cause heart disease, stroke, kidney failure. From an orthopedic or arthritic perspective, worn out knees, degenerative knees, ankles, hips, and then psychologically, obesity is a lifetime full of suffering and pain. The disease is not necessarily just within the child. The disease is the family and the community. The thing that makes this all happen is a family who's dysfunctional, that a family who's not setting the right example at the dinner table, breakfast table, what they send their kid off to lunch or off to school with for lunch. A family who has food that's too accessible, the wrong kinds of foods, the wrong varieties of foods. The family that uses foods in a different way to reinforce good behavior. Hey, you did a really good job, here's a lollipop. I mean, those kinds of things start to make a kid look at food in a different way. And so he's eating inappropriately. But it's the family. And the reason why it's important to understand that it's the family problem is because that's really where the solution is. And when you structure around Tommy or the child the proper foods to eat and the timing to eat and give him good example, that's when the disease starts to be corrected. Send their kid off to school with a good nutritional breakfast, protein that's giving him energy that lasts through the morning. And you get a lot of benefits from eating on a time-wise basis correctly. Tommy's more awake in school, he's doing better schoolwork, he's not famished when he gets to lunch, he's not bothering other kids for their snacks. He's not overeating at lunch. If you've packed him the right lunch, then he's eating what you've decided for him. And then when he gets home, then a good dinner doesn't make him so sleepy that he can't do his homework, makes him sleep better. I mean, there's just a lot of benefits to building the right nutrition at home. We suggest to the parents and the families to come in. We like to sit down and discuss what their concerns are, discuss how severe the obesity is. But what we like to have is a one-on-one conversation with parents, with the adults in the family, to start to make decisions about diet and exercise. And that includes, at St. Jude, that includes dietary nutritional counseling that we have available through our programs, which can help enforce the varieties of foods, the quantities of foods, a little bit of the food pyramid type tactic, things that can give parents good strategies for starting the program.